Hello everyone, in today's session we'll be learning about the muscles of the foot through the anatomy decoded notes, and this is the QR code that you all can scan and get access to all our notes. Okay, so muscles of the foot, how many muscles we'll be learning, it is shown in this table. Okay, so muscles of the foot are divided into two groups. One is the dorsum of the foot and one is the sole of the foot. Okay, so there is only one muscle in the dorsum of the foot and 18 muscles are there in the sole of the foot. Okay, so many muscles are there, and for these muscles we won't be learning about the origin and insertion of the muscles. We'll be learning the location of the muscles and the nerve supply of the muscles and related applied anatomy. Okay, and in the previous videos we have already covered all these muscles with the origin, insertion, nerve supply, action and identification in the cadaveric image. If you all have not seen that, please go through them. Okay, you'll get all of them in the lower limb playlist of this channel. So let's begin with the muscles of the foot. So here we can see two images. One image is showing the muscle of the dorsum of the foot. Okay, so there is one muscle in the dorsum of the foot that is called as extensor digitorum brevis muscle. Okay, and here one more muscle is labeled extensor hallucis brevis, but it is not a separate muscle. If you see carefully, this entirely is one muscle. Okay, and the medial most slip of this extensor digitorum brevis, it is called as extensor hallucis brevis. Okay, so this is not a separate muscle, it is just a part of the extensor digitorum brevis which goes towards the hallux. Okay, hallux is referred to as the great toe, so the muscle is referred to as extensor hallucis brevis. Then this image shows the muscle in the sole of the foot, the first layer. Okay, in the sole of the foot there are 4 layers of muscles that we'll be learning, and in each layer there are some set of muscles. Okay, so in the first layer of the sole of the foot there are 3 muscles. One of them is going towards the great toe, one is going towards the little toe, and one muscle is present at the center. Okay, so one muscle which is going towards the great toe, that is called as abductor hallucis. One muscle going towards the little toe is abductor digiti minimi, and the muscle which is present at the center, that is the flexor digitorum brevis muscle. Okay, digitorum, as the name implies, it goes to the digits, the lateral 4 toes. Okay, then sole of the foot, second layer and third layer are shown in this two images. Okay, so this image shows the sole of the foot second layer. Identify the muscles here. So this muscle is lumbrical. The first lumbrical is labeled. These lumbricals are attached to the tendons of flexor digitorum longus muscle. Okay, just like lumbricals are attached to the flexor digitorum profundus muscle in the upper limb, similarly in the lower limb they are attached to the tendons of flexor digitorum longus. Okay, and if you carefully see these muscles, the first lumbrical is a unipinnate muscle. Okay, muscle fibers are coming only from one side, and the remaining 3 lumbricals, second, third and the fourth, they are referred to as bipinnate muscles. Okay, muscle fibers will be coming from both the side to form the central tendon. Okay, and nerve supply of the first lumbrical and the remaining 3 lumbricals, they are also different, that we'll be seeing later on. Okay, in the second layer of the sole of the foot there are 4 lumbricals, and there is this muscle, flexor accessorius muscle, also referred to as flexor digitorum accessorius or quadratus plantae. Okay, look at the shape of this muscle. Okay, this entirely is one muscle, quadrangular shape. Okay, and this muscle is attached to the tendon of flexor digitorum longus. Okay, it strengthens the flexor digitorum longus for the flexion of the toes. Okay, so in all there are 5 muscles in the second layer of the sole of the foot. How 5? 4 are the lumbricals and one is flexor accessorius. Okay, these 2 muscles I'm not counting because we have already counted it in the posterior compartment of the leg. Okay, just tendons of these muscles are present here, tendon of flexor digitorum longus and tendon of flexor hallucis longus. Okay, hallucis longus will go up to the distal phalanx of great toe, digitorum longus will go up to the distal phalanx of the lateral 4 toes. Okay, the next layer is the third layer of the sole of the foot. Here there are 2 muscles which go towards the great toe. Okay, and one muscle is for the little toe. So 2 muscles which are going towards the great toe are flexor hallucis brevis and adductor hallucis. Okay, these 2 things which are labeled here, those are actually parts of one muscle: adductor hallucis transverse head and adductor hallucis oblique head. And one muscle towards the little toe is flexor digiti minimi brevis. Okay, so like this, in all there are three muscles in the third layer. Okay, so in the first layer there are three muscles, third layer there are three muscles, second layer there were total five muscles. Okay, so layer 1, layer 2, layer 3. So total how many we have covered till now? 5, 6, 7, 8, 9, 10, 11. 11 muscles are done and 7 more muscles are there in the fourth layer. Okay, we'll see them now. So these images show the muscles of the fourth layer of the sole of the foot. So here basically the interosseous muscles are there. There are 3 plantar interossei and 4 dorsal interossei. The word interosseous means between the bones. Okay, between which bones? The metatarsal bones. Okay. So plantar interossei 3 in number, dorsal interossei are 4 in number. And we can see tendons of fibularis longus and tibialis posterior. Okay, number wise it is not counted here because this tibialis posterior was counted in the posterior compartment of the leg and fibularis longus was counted in the lateral compartment of the leg. Okay, and we can see separately also this plantar interossei and dorsal interossei. And this plantar interossei, look at the muscle fibers. Plantar interossei are unipinnate muscles and dorsal interossei are bipinnate muscles. Okay, now let's cover the nerve supply of the muscles and identify them in the cadaveric image. Okay, so muscle in the dorsum of the foot, extensor digitorum brevis, it is supplied by deep fibular nerve. Okay, this nerve is the nerve of anterior compartment of the leg that will descend down and it will supply the dorsum of the foot as well. Okay, and the medial most slip of the extensor digitorum brevis was called as extensor hallucis brevis. That is also supplied by deep fibular nerve. Okay, so identify the muscles here. Number 1, the muscle is extensor digitorum brevis. Its medial most slip going towards the great toe is extensor hallucis brevis. Okay, then this image shows the sole of the foot first layer. Okay, so identify the muscles here. The muscle in the center is flexor digitorum brevis muscle. Muscle towards the great toe is abductor hallucis. Muscle towards the little toe is abductor digiti minimi. Okay, and nerve supply of these muscles, 2 of them are supplied by the medial plantar nerve, flexor digitorum brevis and abductor hallucis. Laterally there is this muscle abductor digiti minimi that is supplied by the lateral plantar nerve. And this medial and lateral plantar nerves are branches of which nerve? Yes, it is the tibial nerve which divides into its terminal branches, medial and the lateral plantar nerve. Okay, and most of the muscles of the sole of the foot, they will be supplied by lateral plantar nerve. As we see the remaining muscles, only few muscles are there that would be supplied by medial plantar nerve. Okay, so here this image shows the remaining layers of the muscles. First lumbrical, identify the first lumbrical here. Okay, attached to the tendons of flexor digitorum longus, supplied by medial plantar nerve, and remaining second, third and the fourth lumbricals, that is supplied by lateral plantar nerve. And flexor digitorum accessorius, that is also supplied by lateral plantar nerve. Okay, and tendons of flexor digitorum longus, flexor hallucis longus are seen here. Okay, these muscles would be supplied in the posterior compartment of the leg, the tibial nerve. Okay, then muscles in the third layer, 2 muscles to the great toe, one is flexor hallucis, one is adductor hallucis. Okay, flexor hallucis is supplied by medial plantar nerve, adductor hallucis is supplied by lateral plantar nerve, and flexor digiti minimi brevis, muscle present on the lateral aspect, supplied by lateral plantar nerve. Okay, identify those muscles here. So in the second layer we saw the lumbricals. Okay, these are the lumbricals. Then this muscle is quadratus plantae. Okay, and this is the tendon of flexor digitorum longus, tendon of flexor hallucis longus. Okay, then in the third layer, number 6, the muscle is flexor hallucis brevis. Then adductor hallucis number 7 and number 8 is flexor digiti minimi brevis. Okay, and this image shows the fourth layer of the sole of the foot where there are interosseous muscles. Okay, 3 plantar interossei and 4 dorsal interossei. Okay, so number 9 which is seen, that's the plantar interossei. Number 10 is the dorsal interossei, and all the interosseous are supplied by lateral plantar nerve. Okay, apart from the interossei, tendons of fibularis longus and tibialis posterior are seen here. Number 11, see the tendon, okay, seen very nicely crossing the sole of the foot from lateral to the medial aspect, going towards the base of the first metatarsal and medial cuneiform. Okay, base of first metatarsal and medial cuneiform, there is one more muscle attached. What is that? Yes, tibialis anterior muscle. Okay, tibialis anterior, the muscle which is present on the medial aspect here. Okay, so for both these muscles, the bones are same for the insertion. Okay, base of first metatarsal and medial cuneiform. Okay, so identification of these muscles and the nerve supply, this much is expected from the sole of the foot. No need to read about individual origin and insertion of the muscles. Okay, now let's cover the related applied anatomy. So there are some neurovascular planes in the sole. Okay, so there are two neurovascular planes which are present between the muscle layers. One is the superficial neurovascular plane that is present between the first and the second layers. Okay, it contains the trunks of the medial and the lateral plantar nerves and the arteries. Okay, and there is one deep neurovascular plane that is present between the third and the fourth layers. Okay, it contains the deep branches of the lateral plantar nerve and the artery. Okay, so neurovascular plane is present between the first and the second layer and between the third and the fourth layer. Okay, so these are the planes that you should know where the neurovascular structures are present. Then this lumbricals we saw attached to the tendons of flexor digitorum longus. Okay, the first lumbrical is unipinnate, second, third, and the fourth lumbricals are bipinnate. Then there is something called as tie beam for the transverse arches. Adductor hallucis muscle transverse head forms the tie beam for the transverse arches. Okay, and which muscles support the medial longitudinal arch? Medial longitudinal arch is supported by the tibialis anterior muscle, and lateral longitudinal arch, it is supported by the fibularis longus muscle. Okay, then adduction and abduction of the toes. Plantar interossei causes adduction of the toes and dorsal interossei causes abduction of the toes. Okay, it can be remembered by a mnemonic PAD and DAB. Plantar interossei is for adduction and dorsal interossei is for abduction. Okay, then there is a groove under the cuboid bone. Okay, cuboid is one of the tarsal bones. When you see underneath the cuboid, it is somewhere in this region. Okay, that groove is for the tendon of fibularis longus muscle. Okay, fibularis longus passes through it to reach up to the base of first metatarsal and medial cuneiform. Okay, so this was about the muscles in the dorsum of the foot as well as sole of the foot. Okay, make sure you all access the notes that we make for you all. Even hard copy of the notes you all can order from this store. It will be delivered to your home. Okay, thank you.